Danielle and Alex, welcome to the stream here, to the show. How you guys doing today?
Hey everybody, happy Friday. I'm doing well.
Similarly, greetings everyone. Hope everyone's having a nice, gentle close of the week.
Fantastic. So for our audience here, just quick introductions. Dr. Danielle Richardson is a practicing OD in Los Angeles. She also runs a holistic wellness company where she teaches yoga and hosts all kinds of events. She's got a fantastic Instagram page. You can learn more about it at Fierce Clarity, of course. But her primary goal is to prevent stress and reduce burnout. So you can check that out. And then Dr. Alex Rodrigues is a practicing psychologist out of Denver, and Dr. Rodrigues has worked in a variety of settings with a variety of individuals, including psychiatric hospitals, correctional facilities, outpatient clinics, and also does consulting for corporations around mental health issues. So just getting into our discussion here for the day, for this session, there's definitely a lot to talk about, and there's no question that COVID has really impacted just about every aspect of the way we live, and of course our businesses, our practices. But oftentimes it's easy to forget the immediate psychological impact COVID has had on ourselves and on our patients and our social lives, of course, and how that might evolve and change as we move forward. So we thought it'd be important just to talk about these things, the psychology around COVID, how that impacts us as providers, and how that impacts our patients, of course. So Danielle, why don't you tell us just a little bit about maybe some of the feelings you first had when COVID kind of started? What were those feelings that you had? What did you feel personally? And then we can get into the patients. And then Alex, of course, would like to hear from you as well.
So COVID initially to me was a peripheral issue. Like some news I was following, it was off to the side, like it was happening in China and in Europe, and it was something to be concerned about. And then obviously towards March, as I continued to follow the news, I realized that it was inevitable that, a shutdown was going to be necessary to sort of contain the virus, and just following the models of what had been successful in other countries who had successfully contained the virus. So how I felt about it initially was, going from that discovery phase into an understanding phase of how severely impacted our lives were going to be. Now, initially, I don't think I anticipated the duration. I mean, I knew that it would take, that COVID would be here for a while, but personally, I didn't really, at the beginning of things, I thought the shutdown would be enough to sort of tamper the virus. And I thought that things would resume normalcy sooner rather than later. So it was quite an experience just to kind of go from COVID being some thing I was hearing about or reading about in the news to being directly impacting me and my life and our practice and our patients. So we shut down for a while. And honestly, this is really unpopular, and I kind of try not to say this too much, but during that shelter in place in California, I honestly really enjoyed the time off and like that time of quarantine. And obviously there's a lot of like suffering and there's a lot of negative things that come along with COVID. But I think just having the mental break from the hustle and bustle in daily life and that time to sort of reflect and reevaluate what was important in my life, ultimately, like on a very personal level, was a positive, even though the circumstances in and of themselves are not positive. So my psychology kind of went from, not really aware to concerned to nervous to having a positive outlook and just trying to use that time as best as I could. And now, as we're here living with COVID for probably, the next year or so, it's sort of adapted to like, how do we operate within these new confines?
Yeah, and Alex, how about you?
I think probably much of this similar experience to Danielle, which probably could be extrapolated to everyone everywhere. Initially here in North America, it very much was a peripheral issue. It was something that wasn't necessarily at the top of the news stream. For me, I can recall when my fears and concerns became crystallized. It was the evening of the presidential address, and you had the coalescing of kind of three events that really defined this as an imminent threat. You had the presidential address, the shutting down of travel from US to Europe. Simultaneously, you had the NBA suspending their season indefinitely. And then you had Tom Hanks and his wife, someone it's probably internationally, there's probably few people readily more identifiable than him acknowledging that they were sick. And then I think kind of over the next couple days, 2 weeks to maybe 3 or 4 weeks, a lot of the feelings that are being reported widespread that I experienced, feelings of helplessness, hopelessness, denial, and trying to reconcile with just this burgeoning sense of uncertainty.
Yeah. And it's interesting because you had mentioned there about the shutting down of things. And I would say that many of us might have continued to practice a little bit when this kind of all started. And I'm sure we're starting to observe some patient behaviors in our clinics. And then at some point, we shut down our own practices. So what was some of that patient psychology or even your psychology that you were feeling when you were still practicing, maybe in a limited capacity? And what were you seeing with your patients? And then ultimately, what made you decide, okay, now's the time I really need to shut down my practice and just wait and see what happens?
So I practiced here in Los Angeles, and my patients are, I would say, like mainly creative professionals, a lot of international travel, a lot of bi-coastal people, a lot of people who work in entertainment and film and in those industries. So there is a lot of travel. So I would say sort of at the beginning of March, we started to notice that those questions, we started to kind of ask a little bit more seriously, have you been to Europe in the past 14 days? We started to kind of take some of those initial questions a bit more seriously. We also started to consider not letting multiple people in the exam room at the same time. And we could kind of notice that the patients started to similarly ask us, like, what do we think about coronavirus and how is it going to impact things? So there started to be a lot, the frequency of the conversation around coronavirus started to increase. But for us, the CDC sort of made that recommendation for us in mid-March, like maybe around March 12th or 15th or something like that. The CDC recommended that routine eye care and routine dental care be suspended. So for us, that was kind of our, that coincided with California's shelter in place order. So it was kind of a no-brainer for us on when it became actually time to shut down. And so we were closed for about 8 weeks, just doing emergencies only. I work kind of in a group of 4 practices, and there was just one doctor doing emergencies during those 8 weeks. But we opened up on a limited schedule once the shelter in place order ended. And psychologically, there was a huge difference in patients, obviously, before the shelter in place versus after. So now patients are more concerned with sanitization. They're more concerned with cleanliness. Like, how are we, what is our office doing to keep them safe? And before, it was more so just general concern about coronavirus and what, just help them being able to ask me questions to help them sort of decipher the medical information they were reading online. So that's the biggest change psychologically, is that now, obviously, kind of to Alex's point, right, this peripheral issue now affects everyone's issue. And luckily for me, because we're in California, and California was one of the more strict states from the beginning, it's something people take very seriously here. So we don't have, at least in my patient population or the people I come in contact with, I'm not having a lot of denial or a lot of people who are upset with the precautions we're taking or anything like that. So we made the decision to close kind of based on California's guidelines and the CDC. And then we made the decision to reopen, obviously still continuing to follow those CDC guidelines.
Yeah, absolutely. And Alex, when did you decide that you would stop operations, so to speak, and what were some of the reactions from your patients?
Probably when airplanes stopped filling middle seats. That was a good cue for me.
Yeah.
So admittingly, I was still traveling because of the nature of my work, still traveling in kind of mid-March, and seeing what I thought a lot of institutions who were starting to apply a very conservative, very concerned approach. There was a part of my work that is risk related that always has to be done in person and didn't translate well, or there's concerns about translating the teleassessment. So there was that component that still stayed alive. And simultaneously, there was also large swaths of my business just shutting down. I think for the most part, Similar to Danielle, taking the cues and the messages from the World Health Organization, the CDC, here in Denver, the Colorado State government, as well as local Denver government, and just really being sensitive to the growing unease and concern about this illness. That's really what kind of queued it up for me. And then similarly, listening to colleagues. I think we're all members of professional organizations. We're all on listservs. And just kind of seeing the increasing deluge of emails about COVID-19 and what people are doing. That was for me. I think that solidified, and at that point, it was very, very necessary to hit the pause button.
Yeah, absolutely. And you had mentioned a few things there just about the nature of your work, and obviously both of you decided to cease operations for a bit. And I'm sure it was a realization that really no industry was insulated, so to speak. And what I mean by that is there were so many people that were losing their jobs or laid off or furloughed, et cetera. You were shutting down your clinics, you weren't working. I mean, how did that affect just your psychology around just general job security and thinking about what you do for your career? And did you have concerns around, oh my gosh, am I ever going to be able to go to work, or when will I be able to go to work, I guess is better. And what were just some thoughts around that?
I will admit very candidly, because I think it's important for people to kind of normalize the anxiety and the fear. The first 3 or 4 weeks of lockdown was very concerning for myself. I did all of a sudden find myself being much more sensitive about money issues, being much more cognizant of where I was spending my money. Hell, even being more cognizant of where my wife was spending money. And that's not historically a behavior that I display. But as I referenced a moment ago, historically, my work is very much done in person. Tele-assessment has kind of only been a recent development. Teletherapy has been increasingly embraced. But there was very much this concern of, what am I going to do? And how long is this going to go on? And so there was tremendous trepidation. I spent a better part of my workday working my cases, completing whatever necessary assignments I had. And then in the evening, trying to very quickly get uploaded on teleassessment. So, I mean, they were very long, exhausting days.
Yeah, I similarly, the reality, so I'm an independent contractor. I'm not a salaried employee. So the reality is, if I don't work, I don't get paid. So, I mean, I really quickly had to make a decision about what type of attitude I would have, because this, we had no idea how long the shutdown would last. So what I decided to do was just to be optimistic and to be positive. And I mean, I know it's, a little bit like rainbows and unicorns and butterflies, but in my experience, that positive attitude, and also, personally, really surrendering to not being in control of the situation and allowing it to be experienced as it was really, really important for me. So I decided to use the time wisely. I took it as a break. I've taken month-long vacations by myself multiple times in my life. So I just decided to create that for myself at home. And while money was a concern for me, I'm really blessed, because every single month there were just things that would happen, and I had savings and that kind of thing. So while money was a concern, I was actually really in a great position where I didn't have to drastically change my lifestyle, even though I wasn't working. But to Alex's point, what it has changed for me is how I think about money in general, because now that I know we've had to be closed for 8 weeks, what happens if that happens again, right? Yes, I cannot work for 8 weeks, but can I not work for 20 weeks? And so I think thinking about being an independent contractor, thinking about my sources of income, and thinking about just the finances of how I'm existing professionally has become top of mind, and creating, some more solid and stable structures has become a bit more important to me, as I kind of feel like you have to hedge against what might happen in the future. So that first Monday not going to work, I mean, honestly, I was fine with it. Like, I just took it as a little vacation. I mean,
Yeah.
I needed it. Like, I didn't realize it, but I mean, I travel a lot for work. I work in multiple offices. I do a ton of stuff for Fierce Claire. Like, I was just really busy and on the go, and like having that time to actually slow down and pause and really reevaluate my own work schedule and all of my different professional projects was ultimately additive. But the money piece was a bit anxiety inducing, but that's where like my holistic practices of, surrender and like spirituality and prayer and like all of these different sort of metaphysical practices kind of where I was able to put them to use so that I can manage my stress and anxiety and be able to actually enjoy the time as opposed to be really fearful and stressed and scared the whole time.
Yeah,
So,
yeah,
and
go ahead, Alex.
yeah, if I could just jump in for a second and kind of do a couple things that Danielle did organically there, we know are very helpful during psychological crises. The two things that I heard is she very consciously drew a line between what she had control over versus what she didn't. There's no quicker way to go down the anxiety rabbit hole than trying to cajole or muster something that you don't really have any control over. I'm not inventing a vaccine. There are much brighter, much more dedicated people who are doing that. And so I'm really on the receiving end, like a lot of people in this pandemic. The other thing that I heard, she talked about viewing this as a downtime, a chance to re-energize, and that the psychological mechanism or the tool, the approach that we would assign to that is called a reframe, a cognitive reframe. And essentially what that is when confronted with a problem or a challenge, almost in a psychological sense, taking a step to the side and looking at it from a different perspective. Okay, so here's this pandemic. I'm going to be down for a little bit. My business is going to be suspended. You know what? What can I do? Well, I was looking forward to some time to re-energize my batteries. Maybe there was aspects of my business that I haven't been able to develop because I'm just working every day. And so these are some of the tools I would implore anyone to put in their psychological toolbox. The most important thing when it comes to coping and coping skills is we want to have a lot of tools. So I definitely commend Danielle, and I think setting an excellent example for others.
Yeah, no, fantastic. Really appreciate the insight there, Alex. And of course, that's why we were really eager to have you join this discussion for your insights. So you had mentioned something there too that I'd like to kind of build upon. And it also sounds like this provided an opportunity for many of us to have that time, that downtime for some reflection, of course. And there's that period of time and you're reflecting, and then you face the decision of, okay, should I start to reopen now, right? Because the sentiment, the mood kind of shifted, businesses started reopening, the guidance had changed. So how did both of you really approach the decision on reopening or resuming services? So Danielle, why don't you start?
Yeah, so we reopened to 2 days a week once California's shelter in place order ended. And I was very apprehensive at first, just because, I essentially been home by myself for 8 weeks. And the idea of interfacing with the general public was not something that I was super keen on doing. But again, to Alex's point about reframing things, right? It's like there are frontline healthcare workers who have been working this entire time. So I just kind of felt like although I was nervous and a little bit anxious about returning to work, it was something that was going to happen at some point. And there are other doctors and other, healthcare professionals and even essential workers who have been working the entire time. So that kind of helped me sort of muster the courage and to kind of get over it in a way that was meaningful. And we decided to open up just because the business, honestly, the store where I primarily practice, we've only been in business. It'll be 2 years in August. So we couldn't sustain being closed for much longer. So that was kind of that main reason, like an economic driver, like many other businesses, why they opened. But it was also because we have that backlog of patients who has been calling us and like needing, they broke their glasses, they're out of contacts, just like all of those things that kind of have come up over that time we were closed. So when we made the decision to reopen, it was based on the California guidance. And personally, I was a little bit anxious at first, but recognizing that, this is the line of work I've chosen to do. So like work, because the nature of an eye exam, right? What is that? Like they were like, we have breath shields, but okay. You know what I mean? There's so
I
much
bet you weren't doing ophthalmoscopy, right? For the first first couple of weeks. Pulled out the 90 diopter lens for sure, I'm sure.
So, I mean, just thinking about, those changes in the examination and what it means to do an eye exam, how close you are to people, and just kind of coming to peace with that. That is the experience that, as a healthcare professional, I have chosen this profession. I've sort of taken an oath even, to treat my patients and take care of them no matter what. So, although initially there was some anxiety and some apprehension, ultimately I felt really, empowered, and I felt confident to do the job that I had been trained to do, no matter what conditions are going on in the world.
Yeah, and Alex, I'm very curious to hear about yourself because Danielle, you'd mentioned anxiety, right? And Alex, I'm sure that that many patients have come to you for guidance and for counseling on issues around anxiety and obviously a slew of other things, but we're at a time now where you yourself might have anxiety, right? So what was that like?
Yeah, well, I admittingly, I'm a pretty anxious guy to begin with, so it doesn't take much for me to ratchet up the temperature. And I jokingly say that anxiety is a word created by psychologists, so men could say they were scared without actually explicitly saying they're scared. I would kind of, just to go back for a moment, encourage people to think flexibly. And so in this decision, in this dichotomy of open or not open, there's actually considerable play in there, right? There's this idea of, okay, if I'm thinking flexibly, I'm thinking creatively, what I may not open the way I did in February 2020, but in a similar way to kind of Danielle was saying, what could I potentially do? What capacities could I work? And I think, again, it's, if we're thinking about ways to kind of move through this pandemic or just through life in a psychologically healthy manner, it's going to be this thinking flexibly as opposed to this forced dichotomy. When it comes to anxiety is very much essentially a sense of apprehension about uncertainty, which is everything about this pandemic right now.
Absolutely.
For myself, with the people I work with in whatever capacity, whether it being collaborative or a treatment aspect, the things that we know that work really well with regards to communication in crises is being transparent, which is sharing the information that one has, being honest, acknowledging there are things that I don't know right now, and simultaneously I am scared. And third is being empathic. I'm being much more accommodating. I'm trying to be much more flexible with my schedule, with the demands and needs of others, and recognizing that we're all in this together, and we're either all going to cross the finish line or none of us are.
Yeah, absolutely.
Yeah, and with the continual need for social distancing, right? How do you think that this is going to impact everyone and anyone, really from a social perspective, and obviously in the clinic, in the exam lane? What are your thoughts there, Alex? Why don't we start with you?
So one of the things is human beings are social creatures. Even those of us who would most readily identify as introverts and prefer to spend a better part of our evenings just binging Netflix, all of us still crave some type of social attention. I could say, I think that the yearning for social attention was so much, especially in the beginning of the pandemic. I mean, I just had random strangers in my neighborhood. We would just start talking because we needed to talk to someone else. I mean, there is going to be that yearning element. People are going to be, because connectivity is one way that we defend against anxiety. As people come back into the office, as they come back into the professional space, they're going to be kind of humming with a little bit more. And we know when people are anxious, their cognitive abilities are taxed. They may not be thinking as clearly as they normally do. They may not be as quick as they normally are. Their patience, their ability to empathize is going to be limited. So I would imagine some people are going to be a little bit more abrupt in the professional setting. And then there will also be some people who are going to have a very difficult time regulating or changing their behaviors in our new pandemic world. We see it here in the States, and I'm sure there's other places internationally where wearing a mask or not wearing a mask has become a political tool. And so we're gonna have to manage all these nuances together.
Yeah, Alex, you had mentioned something there that had me laughing, because it's like you said, we have this social distancing thing. We haven't seen each other for a while, and you get that urge to just have some sort of social interaction with someone, right? And Danielle, I'm very curious to hear your thoughts about this, because you want to have that social interaction. You're dying to get in the exam room, right, with your doctor. I mean, that's a social interaction when you start reopening. But at the same time, you have that sort of anxiety, like, man, I have to get through this exam quickly. As much as I want to sit here and have this interaction, geez, I want to get through this. I want to be fast. I want to be efficient, so I could get this person out of my room and proceed with the next exam, but also limit the amount of time I'm with them. So what has that been like back in the exam room, just maintaining this sort of social distancing, navigating the feelings around that, but at the same time, maybe adjusting your workflows to get them in and out a little bit more efficiently? And how do you think that's going to impact perhaps the rapport that you can develop with these patients?
So once we initially reopened, there was two main demographics of patients who were coming in mid-May. There was one hand, like the emergent cases, or people who really needed their glasses or contact lenses. And then you have this other demographic who I feel like just wanted to get out of the house and like didn't need anything, just wanted to, have an appointment. So once I started to kind of recognize like that, right, the social aspect of the exam and like what people are looking for, it did modify how I do the examination. So before I would, sort of talk a lot at the beginning, we would do the examination, we would chat more at the end. Whereas now I kind of condense the examination portion, and luckily we have a digital phoropter, so I'm not having to stand over the patient for the refraction or the history taking. I'm actually able to be pretty close to 6 feet away from the patient for the majority of the exam. But the actual slit lamp examination in that portion is much more quick. I do it more quickly than I did prior to COVID. But what I have kind of done is, instead of taking all this time to talk at the beginning, then do the examination, then all this time to talk at the end, we kind of do a quicker examination, and then we talk a little bit more from 6 feet away, just to make sure that whatever it is that the patient is there for, we're able to address it without me having to be like in their face and having that same conversation face to, like, in close proximity. So how the social distancing has changed the exam for me, luckily our exam lane was already set up in a way that 6 feet of distance, even during the refraction, is kind of possible to achieve. But I have condensed the clinical examination. And I mean, I used to explain everything I did to patients just to really make them feel taken care of. Now, obviously, I don't do that. I'm just kind of give a high level overview, and then we talk about the results afterwards. But I found like just kind of getting that part out of the way and then allowing that time for conversation at the end from 6 feet away I haven't really felt there be an effect on patient rapport. Like, you still see expressions in the eyes, even though a patient's wearing a mask. You can tell, you can see fear in their eyes, anxiety, worry, happiness, excitement. You can still see those emotions in their eyes. So I think what has shifted for me is moving to spending a little bit more time after the clinical portion of the exam to not only talk about whatever our solution is for that patient, glasses, contacts, change in prescription, but to even talk a little bit about COVID, to talk about, why they're feeling apprehensive. And to really, I think the biggest change for me is that element of the exam, almost like it's become like kind of not a therapy session, because obviously that's not what I'm doing, but in some ways people want to talk, way more than they did prior to the examination. And so
we'll send them to Alex. We'll send them to Alex.
Well,
we have a referral to make.
We didn't plan this, but I think Danielle, intuitively, organically, she has a really nice sense, because we actually see her implementing the things that make for effective communication in a crisis. For instance, a little bit, I talked about transparency. Okay, so she's explaining to patients, clients, what have you, hey, we're going to be changing our processes for a little while. It's going to be maybe a little awkward in the beginning. There'll be some fumbling, but this is what we're going to do in order to make sure everyone's safe. And then she's bringing up that other element, empathy. She's allowing the opportunity for clients who are stressed, who are feeling anxious, a little bit more time to talk. And so we're seeing these principles manifest in real world practical applications, which do very much bring about positive consequences. So again, kudos.
Yeah.
Thanks. It's nice to hear the actual terminology, you know what I mean, to go along with the action.
Yeah, for sure. And a lot of what you had mentioned there just made me think about just the way that you're practicing now, right? And what the future looks like. And we're going to jump into that in terms of how will this affect the way you practice now and into the future. But before we get there, and someone asked this question in our chat, so if you're watching along, you can ask questions. I'm watching the feed here to answer questions. But it's interesting, right? Because in the city where I'm from here, a lot of restaurants had reopened, a lot of bars had reopened, and there were a lot of people that went and were frequenting these places. Obviously, we've seen the numbers and cases rising, and now the city says, okay, you know what, we're shutting back down, right? Practices are still open, and a lot of other businesses are still open. They didn't shut everything down, but someone asked a great question here. How are you going to prepare in the event there is another shutdown that affects the services that we provide? So really curious to hear both in terms of maybe some tactical things, whether it's looking at telehealth services. I think, Alex, you'd even mentioned that a little bit previously, but also just psychologically, what are you doing to prepare for that yourself, maybe your staff, and patients?
I would encourage people that, first off, if the situation unfortunately were to return where we're closing down, we're actually in a little bit of a better place in terms of planning than when it started. Okay, we've already been operating at this altitude. We've already learned some lessons, and we're going to implement those. Taking the time to consider what I would say is an if-then strategy and mapping out different possibilities. And that's just simply, if scenario X happens, then I will do Y action. All right, so just thinking, if we have to shut down again, or if I have to limit the amount of occupancy in my waiting room, then I will do whatever. Okay, so I think, you know, in a reasonable degree of proportion, I'm not suggesting people ruminate or worry about this all day long, but spending a little bit time planning is excellent. As I say to a lot of my patients and my clients, hope is a great thing. Hope is important, but I just don't want hope to be my only plan.
Yeah, from my perspective, what we're doing, like from a patient care perspective, is obviously annual, like buying that year supply of contact lenses has always been important in practice management, but now it's of direct importance because it's like, look, you know, we want to make sure you have everything you need. We're really encouraging patients to get all the contacts for a year, get new glasses if there's, you know, any chance that their glasses are old or going to break, and really trying to encourage patients to have everything they need in the event there is another shutdown and they can't come see us. But we while there is some telehealth capacity, I think largely what we will do is similar to what happened before, is where we will see emergency patients. And you know, our philosophy is emergency is different, right? If you're a -6 and you broke your glasses and you don't have any contacts, that's an emergency for you, you know? So there is a little bit of flexibility in what we consider emergency. So it's really kind of priming our patients to understand that we're going to be in this coronavirus situation for the long haul. So make sure you're prepared and make sure you have everything you need: glasses, contact lenses, and any ocular medications. Personally, I'm really thinking about it from a financial planning perspective. So I was able to, you know, get a PPP loan. Like I said, I'm an independent contractor. So like, you know, being able to kind of use all of these economic things that are at my disposal, but to use them to save and to keep it as an insurance policy, and to be really smart with my finances over while I am working in the event that we do have to shut things down again. So personally, I'm kind of like a little squirrel, you know, saving my acorns, getting ready for the winter. But in a similar effect, I've really encouraged, as a store and as a staff, we've really encouraged patients to think about this in terms of a long-term strategy. So this is the year to update your glasses. This is the year to buy an annual supply. This is the year to really make sure you have everything that you need to be at home comfortably.
Right. So let's just fast forward for a minute into 2021. Maybe it's even 2022. And let's, who knows? Maybe there's a vaccine for this. Maybe there's not. Maybe COVID's gone. Maybe it's still around. We can't predict the future. But
maybe we
I'm
got
curious.
something new.
Yeah. Maybe it's something else. Maybe it's COVID-20 or something. Who knows? But I'm curious to hear your thoughts. And we'll start with you, Danielle. Just hearing your thoughts in general around whether or not you think that the things that you're doing right now, in terms of some of the tactical things you're doing and the way you're practicing, will still be the case or become your standard, the standard, right, into the future. And then I would also like to get an idea as well, and this is where I'd really like to pick your brain, Alex, on some of the psychological implications COVID might have had on patients, maybe who have spent a lot of time alone during this entire year. How might they present into the practice? But first, let's just talk about some of the tactical things. Danielle, if you can provide some input onto whether or not you plan maybe on continuing and operating this procedure well into the future.
So right now, well, when we first reopened, we moved to, before we had 30-minute exam slots, and now we've moved to hour-long exam slots. As things have kind of progressed and we've gotten a little bit more comfortable, now we're at 45 minutes. I don't really foresee us going shorter than that. We moved to longer exam times. We also have appointments for frame selections. We don't allow walk-ins any longer. And we also do curbside pickup for glasses, contact lenses, and we do contactless adjustment for glasses as well. So we have sort of transformed the practice into, we call it concierge, like a concierge service. So you call, we take care of you the whole time. You have a person assigned to you, kind of with you the entire time you're in the office. If you're not in the office, similarly, we set you up with an appointment for curbside. So everything is appointment based. And, I think some of that will go away, but what we have actually seen from a business perspective is that it converts a lot higher because we're able to, number one, weed out, separate the wheat from the chaff. You know what I mean? The people who are kind of just coming in, browsing around, wasting your time. We've kind of eliminated all of those people by making everything be appointments, and obviously retail is more limited. But, I don't know how long. I mean, obviously, throughout the duration of this pandemic, we will continue to operate on an appointment-only basis, which honestly has been refreshing, and the patients like it and the staff likes it. So our staff was really concerned about safety coming back to work. So being able to control the number of people in our space, being able to make sure every surface is sanitized after someone has touched it, make sure every frame, every pin, everything that someone has touched is being completely sanitized, limiting and decreasing our overall volume of people we allow, or we're even seeing per day. I think those changes are here to stay through the duration of the pandemic. How that looks afterwards, I don't necessarily know, because we are located on a retail block. So I think as retail shopping returns to normal, I think we'll have to loosen some of those restrictions. But for now, I think, for the foreseeable future, certainly into 2021, we will be doing appointments for frame selection, appointments for just all of these things that never really needed an appointment before. But it's been nice because the patients feel comfortable. They feel taken care of. The staff feels comfortable. They feel safe. They don't feel rushed. And so for us, creating all of this structure around how people enter our space has been really, really powerful. And I think that is a change that we know will stay throughout the duration of COVID, but we'll have to see what happens with the retail landscape as things open up next year.
Yeah, definitely. And it's interesting because when I was practicing, oftentimes a patient would come in, hi, how you doing? Maybe, a touch on the shoulder, maybe a handshake at the end of the exam, things like that. And Alex, I mean, obviously that has changed. That has changed. I can't, if I was doing that, I'd be hesitant to reach my hand. I don't think you see anyone doing that anymore. So there's a lot to speak about, just the psychology of interaction now. And then do you believe that even is that psychology even different for maybe those who have been isolated? Because many of us have been isolated, but we might be with our significant others, and maybe with some family. But there are some people out there who have been isolated by themselves for long periods of time. I mean, what do you think about that, Alex? Can you provide any insight just from your background on how that might affect patients that we see who do come into our exam chair?
Yeah, absolutely. So again, I think the perennial, the kind of permeating response is anxiety, discomfort. Our central nervous systems, they're not really well designed for chronic, low, moderate stress. They're much more designed for acute episodes. And so people are going to be feeling depleted. People are going to feel irritable. They're probably operating with less sleep than normally. We see fluctuations in the wake of the pandemic. Some people are eating less. Some people are coping with food and eating a lot more. And so it's going to manifest in all these different ways. That the individuals who tend to do best in these circumstances are those who can get comfortable with being uncomfortable. As we said earlier, drawing a line, a distinction between what I have control over, what I don't. I would encourage the audience members today to recognize that they are seen by their clients, by their patients, by their consumers as health experts. And with that, it's important to recognize we need to take care of ourselves first. Self-care 10 years ago was a dirty word. Now people are starting to embrace it, but still not practicing enough. And you know, when it comes to self-care and taking care of oneself, especially if you're in a leadership role, it's kind of like what the flight attendant says when you board the flight and they go through emergency protocol. They tell you, in the case of an emergency, put your oxygen mask on first before anyone else's. And there's a very basic wisdom kind of attached to that. If you're drowning, you're not saving anyone else. So you have to be doing things to take care of your own self-care. You know, myself, I've taken a Goldilocks approach to the news. And what does that mean? Is not too little and not too much. I found myself very early in the pandemic consuming just an ungodly amount of news that wasn't particularly helpful. The other thing too, and this is kind of going back to what we said about the power of reframing something, taking a different perspective, is recognizing that this pandemic is a challenge. Okay. And the difference between a challenge and a problem is that with the former, with the challenge, it's going to take sacrifice, but at the end, you'll have been better off for having been tested. There'll be some new resilience. Okay. And you could see that in a practical way with the manner in which Danielle is talking about shifting her practice, building some new kind of long-term financial plans. I've seen it within my field and other health sectors. All of a sudden, overnight, everyone's into telemedicine. All right. We see it on a federal level and a state level, legislation that has been stalled for years. All of a sudden, because the pandemic demanded it, we adapted.
Absolutely.
Yeah, and we didn't plan this, but that was a perfect segue, because in the 5 minutes or so that we have left here, 5 or 6 minutes, I wanted to address a couple questions that came in through the chat. And interestingly enough, someone has a question around telemedicine, and they were hoping that perhaps you could touch on, the two of you could touch on just telemedicine aspects, both in terms of psychology and maybe long-term strategy. So do you think that telemedicine is something that will become more commonplace? I mean, obviously we are seeing, like you said, Alex, legislation changing. I know there's a lot of doctors who are implementing it into their practice. We had a talk yesterday about it. But where do you guys see telemedicine going? Danielle, if you have plans on implementing that or bringing that more into the fold, and then Alex, you yourself, of course, and then what does that mean just in terms of psychology for the future, in terms of, well, I'm used to this type of encounter now. I don't know that I want to go in person to the doctor anymore. Maybe I just want to have this sort of virtual encounter. So maybe Danielle, if you want to speak just about your experience, maybe thoughts on telemedicine implementation, and then we'll get into the psychology of that.
So for us, telemedicine has become a little bit more of like a follow-up tool to decrease patients having to return to the office. And I think it also has a place in emergency cases where people have a red eye or something like that and maybe can't make it in immediately. I don't think telemedicine can in terms of optometry in particular, because what we do cannot be done online. The meat and potatoes of our practicing cannot be done online. So I think for us in particular, it's about, to Alex's point, about being creative and about how do you configure telemedicine within the scope of your practice, right? Are you doing office visits? Are you doing medical visits? It's cash pay. Are you billing those medical visits? Are you doing all of your medical follow-ups via telehealth? I think there's a lot of opportunity in that regard to really establish a robust telehealth practice or component of the practice. But I think, you know, the eye exam and that in office is still going to be a necessary part, just because you don't know what you don't know and you can't really see into a person's eyes virtually. So for me personally, that's my stance on it. I think there is a lot of opportunity for integration within the practice, but I don't think from a long-term perspective, there's really anything to be concerned about, because I get so many patients who have had just purely I think there's a lot of room for growth in terms of optometry and
Definitely.
telemedicine. So I don't think we're at a place now where it's even possible to consider a future without an in-person component. But I do think we're at a place where you really have to be smart about how often are you bringing people back. If you have a medical follow-up, is it really necessary that you see them back? Are you just doing that on a CYA basis? You know, some of those like unnecessary visits, I think really that's the beauty of telemedicine. And while some patients, you're always going to have those people who prefer to do everything from home, and, you know, they're getting the contact lenses online that are not being evaluated in their eyes, and you're always going to have that demographic of people. But what I will say is those people always end up back in your chair because there's a problem at some point down the line. So I think in our particular profession, we still have a ways to go before we can talk about a future of telehealth only. But I think right now in the present, there is really a lot of opportunity and a lot of space to build a telehealth component to your practice.
And Alex, your thoughts?
So I think this is maybe where our fields diverge a little bit, because a lot of what we do within the psychological world can be completed via tele. We don't have the same physical demands. I've had a number of clients, patients really enjoy this. All of a sudden, they don't have to think about an hour commute or 2 hours both way to factor into their day. And similarly, to kind of say what Danielle was just kind of speaking on a second ago, we're thinking about flexibility. People, you know, those people who are innovative, those people who are going to see this as a challenge and something that they're going to thrive through, are going to identify the pieces of tele that they want to integrate into their practice, and the other pieces maybe discard or doesn't speak to them. So again, thinking flexible, thinking creative, that's what we think about when we distill the core elements of adapting and surviving.
Yeah, for sure. And in the last 2 minutes here, 3 minutes that we have left, just want to end on a question that came up in the chat, but also just a general, a good question in a sense, in that when I was in the exam lane, I remembered there were times when I'd be doing an exam, and it can happen, right? Patient sneezes all over my hands, or I've been in situations where patient just sneezes. I'm doing slit lamp, Danielle. You might have experienced patient sneezes in my face. And I'm like, man, how nice would it be if they were wearing a mask, or I was wearing a mask, and now we have the slit lamp shields. And I'm thinking to myself, maybe this isn't so bad, right? There's some good things that could be potentially taken away from this. But so the question is, do you think there are components of this that will stretch into the future, just in terms of around the psychology? And then also, you do have those situations where patients will come in and they don't want to wear a mask. They'll say, I don't want to wear a mask. I've also maybe even have this card that exempts me from wearing a mask. So, you know, and Alex, you had mentioned before that, of course, there could be some political overtones in there mixed in. But even that aside, I mean, how are you maybe handling those kinds of encounters? And do you foresee this sort of change in perception around just cleanliness and the way we do things well into the future?
I mean, we aren't tolerating it. We're just not dealing with it. If you don't want to wear a mask, you're more than welcome to go somewhere else. But like, we will not entertain that. it's science, it's not politics. So we give masks to anyone who doesn't have a mask. Additionally, like one thing that, you know, to your point about people sneezing or breathing, like a lot of patients come in and their mask is like, you know, they're not wearing it correctly, or they
Right.
just kind of have like a loose scarf over their face or something like that. So we're really, you know, very gently encourage, like we'll give patients a surgical mask, you know, to help them if their mask is incorrect, or kind of teach them how to wear them correctly. But we actually haven't had a ton of issues with that. We have had one or two instances, but again, like it's very clearly marked on the door. California is requiring masks everywhere, so at this point it's really not much of a debate here in California. But I do think aspects that will remain, I think the upping level of cleanliness, like how much we are disinfecting everything, I think after doing that for a year and a half, it's going to be really hard to break some of those habits. So I think that there is a level of cleanliness, the overall standard of cleanliness, I think will be raised. Additionally, I do think there will be a little bit more distance between people, like to your point about not shaking hands, not touching arms, you know, not giving pats on the back. I do think that there will continue to be, especially once this ends, there will be a period of time where we're so used to kind of operating in these little bubbles around ourselves away from other people that there probably will be some elements of that. Because at this point, I've noticed in the beginning, it felt really unnatural, but at this point in patient care, it feels really natural to kind of have that separation between people.
And Alex?
This event is going to be weaved into our psychic DNA for many of us for years to come. I think about my grandparents who grew up during the Great Depression. They never trusted banks, okay? Part of that experience was just wed into who they were. And so moving forward, I wouldn't be surprised if we see, kind of like Danielle was saying, more health conscious, more not necessarily germophobic, but germ sensitive approaches.
Right.
And it will, undoubtedly. You can't shift the paradigm and not expect for there to be some lasting consequences. Yeah.
Fantastic. Well, I'd like to thank both of you for taking your time to share your thoughts, your wisdom, your experience with everybody. And we'll have to pick up a part 2 at the next show. I'm sure there'll be plenty more to talk about when that time comes. So until then, thanks again, and enjoy the rest of your days.
Thanks so much. Thanks for having me. Happy Friday, everybody.
Take care, everyone. Be safe.